I'm pleased to call to order this meeting of the CPRIT Oversight Committee. It is now 8:30 a.m. Ms. Payne, please proceed with the roll call.
Dr. Cummings,
Present.
Mr. Margot, Mr. Montgomery,
Here.
Dr. Patel,
Yeah.
Dr. Rice,
Here.
Dr. Rosenfeld.
Here.
We have a quorum.
Members, Dr. Hernandez is not able to attend today's meeting because of business in his city. May I have a motion to excuse his absence?
So moved. Second.
All in favor, vote aye.
Aye.
Any opposed? Motion carries. Members, you have a draft minutes from the February 21st and March 8th Oversight Committee meetings in your agenda packet behind tab 1. Are there any corrections to the minutes as circulated? The chair will entertain a motion to approve the minutes of the February 21st and March 8th Oversight Committee meetings.
So moved. Second.
All in favor, vote aye.
Aye.
Any opposed? Motion carries. Our next agenda item is public comment. Texans created CPRIT. Opening our meetings with public comment underscores this board's commitment to transparency and accountability. Ms. Doyle, has CPRIT received any requests to provide public comment?
No, sir.
Moving forward to item 5. Mr. Roberts will provide the Chief Executive Officer's report.
Thank you, Dr. Cummings. And as shown in attachment 1, if you approve the Academic Research and Product Development Awards at the Program Integration Committee's recommended level of $54.9 million, we will have some $57 million to award for the remainder of the fiscal year. The dashboard of metrics that we track on a regular basis is attached as well. As I sit here, CPRIT has 48 full-time equivalent positions filled. We have today one of our newest employees, Donna Cooper, staff accountant. Donna, if you'd wave, say hi to your bosses. It's also my understanding that later in the meeting, the ad hoc interview committee will recommend a finalist for the CEO position.
We need to pull your microphone closer.
Do you want me to repeat that entire report?
You're fine. Thank you, sir.
That concludes my report.
Very good. Thank you. Are there any questions for Mr. Roberts? We'll move on to item 6. The chair recognizes Mr. Burgess to present the Chief Compliance Officer's report.
Good morning, Dr. Cummings and Oversight Committee members.
Good morning.
Always a pleasure to be here.
Yes.
You know, I just want to start out by saying thank you for your support of the compliance program. And, you know, I'm a giver, so I have given you each a little something in an envelope in front of you. If you want to open that up now and
Say, as general counsel, that's a very scary thing to put in the minutes. Giving you something
it's
in a
not
closed
laced with,
envelope.
it's not laced with anything.
I'm waiting for everyone else to open in case it bites.
Yeah, and I kind of would like to know what might be in there.
So it is a pen that says, I love, oh, Cindy, look at you. And a display of solidarity. We should all put it on our lapels and say, thank you for your support. Will, I don't see yours on yet, so. Not on there. But in all seriousness, thank you. Thank you so much for the support of me and my team and what we do to maintain the transparency and accountability of CPRIT. You'll find my update behind tab 3 in your booklet. Just a few highlights. You may recall from February that we were a bit over on our delinquent reporting threshold. That's a self-imposed 5% threshold. We have, you know, now gone back under that significantly. I think this week's report was even at 15. So I'm pleased to announce that we will be interviewing 2 full-time compliance specialists in the coming couple of weeks and adding those to the team. And we're continuing to have internal discussions on ways we can streamline our processes. And, you know, we were somewhat inundated back in February, January, February with match reviews and that, we had to kind of pause some other compliance activities to kind of all hands on deck sort of situation to get those reviewed. And I'll touch on that here in just a second. But again, as of the end of April, we had 11 entities that had not filed, I think, 18 reports. It's been a busy 3 months. We've had several on-site reviews we've completed and desk reviews. And in terms of our financial status reporting, those are quarterly financial status reports that we provide a second level review of each one of those. My team does, and we did over 530 of those in the past 3 months. In terms of match, as I just mentioned, we had 10 of those in February, March, and April. We've reviewed so far this year over 26.5 million in match reviews. And I don't know if I should get closer or
I was going to
feedback.
suggest, why don't we try it a little bit further away?
How about that? So far this fiscal year, we've reviewed a little over $26.5 million in match review. Now, at the end of last year, the whole year, I think we did about $24 million worth of reviews. So it's a significant increase, mainly due to our increase in product development grants. And we've identified a little over $225,000 in unallowable match expenses. So we work with the grantees to kind of pull those out. We have to make sure that they spend their money on allowable things. So, and lastly, we conducted our first series of trainings in March, and we'll have another set here in June. Those are annual compliance trainings that are required for each grantee. That's my report. I'm happy to answer any questions.
Any questions for Mr. Burgess?
David?
Dr. Rosenfeld?
Could you describe in a few sentences what some of those non-allowable charges were for?
They could be, in the past, they've been office remodeling. I can't think of those right off the top of my head, but, we've been able to identify those and we also provide a resource for our grantees to say, here's some allowable and unallowable. Now, we can't have an exhaustive list. That would be near impossible, but we do try to provide that guidance. But I can get back to you on some more specifics if you'd like for me to.
Thank you.
Yeah, you bet.
Mr. Montgomery?
Yeah, briefly, it's skipping ahead a little bit, but I noticed the compliance department got a very clean and very strong bill of health from the auditors. So I just wanted to make sure to compliment you and the department on that. And then one question, can I take the button off now that you're done?
Well, as long as Mark and Justin got a photo op.
Okay.
So, good.
Dr. Rice?
I was just going to note, I did my math here, and I think that means that 99 point something, but over 99% of these are actually appropriately included as matching funds. And so it sounds like that's a pretty good level of performance, given
Yes.
that there are edge cases and maybe gray areas that people wouldn't know, and you'd continuously be educating.
Yes,
Fair?
sir. I agree.
Thank you.
Absolutely.
Are there any other questions for Mr. Burgess? Move on to compliance certification. Turning to the certification of the award slates that we will consider today. Mr. Burgess, please present your compliance certification report.
Thank you, Dr. Cummings. You'll find my compliance certification in your proposed grant award booklet on page 80, dated May 2nd. This was provided to you in the portal as well. My certification covers from the approval of the RFA all the way to the PIC meeting. And I reviewed all the supporting documentation provided to us by GDIT, our third-party grants administrator. And I also attended the PIC meeting on May 1st. And they behaved themselves and did everything they should have done in that meeting. And I am satisfied that the applications that you're considering this morning followed CPRIT's peer review process, and happy to answer any questions.
Any questions for Mr. Burgess? Thank you so much for your report. Okay, now moving to our program activities section, we're going to start actually with item 8, the Chief Prevention Officer report. The chair recognizes the Chief Prevention Officer's designee today to provide the Chief Prevention Officer's report. Thank you, Carlton.
Good morning, Dr. Cummings and Oversight Committee. How are you? I am here to present the prevention program update. And so the prevention program released 3 RFAs: primary prevention of cancer, the cancer screening and early detection, and the dissemination of CPRIT funded cancer control interventions on February 9th of this year for the first cycle of FY 25. The peer review will take place in the beginning of September, and the Prevention Review Council will meet in the middle of October to make recommendations to the PIC. Ms. Maggot will present the Prevention Review Council's recommendations to the PIC and the Oversight Committee in November 2024. I'm also here to give an update on the Texas Cancer Plan. The timeline for the Texas Cancer Plan has been updated to allow for the development of online resources similar to that of the CPRIT annual report to provide sufficient time for continued stakeholder feedback and for both internal and external review of the data. The 2024 Texas Cancer Plan will be shared with the Oversight Committee members in November and released to the public in December of 2024. And as you can see on the slide, there's a breakdown of the updated timeline. And that's the end of my report.
Thank you, Carlton. Are there any questions for the prevention program? Very good. Thank you for your report.
Thank you.
Okay, please bear with us. We're going to move to item 13. Give Cameron a moment. Chair now recognizes Ms. Eckel to discuss the proposed administrative rule changes.
Thank you, Dr. Cummings and members. The rules are located behind tab 10 of your meeting books. We have both rules presented for adoption as well as new proposed rules. The rules from February meeting, as you might remember, related to adding tranche. Bless you. Related to adding tranche to the list of defined terms, as well as capitalizing the term throughout our rules. It was published in the Texas Register and on our website, and we did not receive any public comments. I know it's very shocking. Yes. I have no buttons to give you to say, but you just know in your heart, it's because our rules are just written so well. So they're presented as we gave to you back in February. We'll send them to the Secretary of State for final adoption if you approve today. And if there are no questions on that, I'll move to the new proposed rule amendment related to, this is actually good timing, the Texas Cancer Plan and CPRIT's requirement in our rules to make it available, make printed copies available to the public. And all the time that we've been publishing the Texas Cancer Plan, we've not received a request to print out the Texas Cancer Plan. The most recent version, it's a PDF, large PDF booklet that's been on our website. And as Carlton just explained, the new Texas Cancer Plan will be much more dynamic online, much like the annual report. So just wouldn't be very conducive to printing it out, but it will still be available on our website to the public. And that is it for the rules.
So in my 6 years, I've been trying to find ways to incorporate tranche into my daily vocabulary unsuccessfully.
Oh,
But
6 years. Wow.
There's always, more time.
Okay,
Well,
yeah. Give
I
it,
just-
give it a few more years.
I was appreciative of the clarification that that is not a pronoun. But I also want to thank our presiding officer for moving this report up early in the agenda. It is always the one I'm most excited about.
I think you better find a button and,
Yeah, but now what do you have to look forward to?
I know it's depressing,
Oh, I'm sorry.
depressing. It's a mental
Yeah.
letdown, but I want to thank you for moving it up, and I'd like to think about us doing that on a regular basis.
we'll work on that. Are there any other questions or comments for Ms. Eckel? All right, members, there is a motion to approve the final orders adopting the rule changes to the Texas Administrative Code, Chapter 701 and 703. All in favor, vote aye. Any opposed? Motion carries. Members, is there a motion to publish the proposed change to the Texas Administrative Code, Chapter 701 and the Texas Register? All in favor, vote aye. Any opposed? Motion carries. Thank you, Ms. Eckel.
you.
If you'll go to item 11 in your meeting book, we're going to take up the Scientific Research and Prevention Program Committee appointments. The chair recognizes Mr. Roberts to present his appointments to the Scientific Research and Prevention Program Committees.
Thank you, Dr. Cummings. I have appointed 39 experts to CPRIT's peer review committees. State law requires you to approve these appointments. At their May 2nd meeting, the Board Governance Subcommittee reviewed the appointees to the Academic Research Prevention and Product Development Research peer review panels, and they recommend your approval. I also request your approval.
Are there any questions for Mr. Roberts? Is there a motion to approve the CEO's 39 appointments to the Scientific Research and Prevention Program Committees? All in favor, vote aye. Any opposed? Motion carries. One page over to item 12 is advisory committees. Turning to agenda item 12, I recognize Mr. Roberts to present the presiding officer's new appointments to the Advisory Committee on Childhood Cancer and the Prevention Advisory Committee.
Thank you, Dr. Cummings. Similarly, at its May 2nd meeting, the Board Governance Subcommittee reviewed the presiding officer's proposed appointments to the Advisory Committee on Childhood Cancers and the Prevention Advisory Committee. The subcommittee recommends that you approve the two appointments, and I also request your approval.
Are there any questions for Mr. Roberts? Is there a motion to approve these two advisory committee appointments? All in favor, vote aye. Any opposed? Motion carries. We will hold our advisory committee presentation to a little later in our agenda. We are now going to move to item 14. Turning to agenda item 14, the chair recognizes Ms. McConnell to present the Chief Operating Officer's report.
Good morning. I don't have any buttons for you either. Sorry. Hopefully you like accounting and all of our facilities work, but anyway. You have my report. I'll just highlight a couple of things. In the quarter two of this year, we did receive almost $150,000 in revenue sharing payments. Of that, $107,000 came from the Merck royalties from the sale of the Wellerig product. Also, we have executed a budget transfer of about $1.6 million or 5.7% out of the cancer prevention grant strategy. This was done under the authority of the Chief Executive Officer. And this money was directed, about 1.3 of it was directed into the award cancer research grant strategy. And another $185,000 was directed in an indirect administration strategy, and $120,000 into the grant review and award operation strategy. So the total for the operations was $305,000. And that money in the operation strategy was to cover some additional, an increase in our Microsoft Azure cloud services, as well as a new contract that we've executed with Govenda Board Management. And then increases that you approved in our outside counsel contracts for intellectual property due diligence. The money that was directed into the award cancer research grant strategy was it will be used to support the awards that you'll be considering later today and then later this year. There is also an additional reallocation of money of $53,109 from academic research to product development, just within that 70-30 allocation split. So that's the total transfer that was executed. Finally, we are also, I've been reporting on the strategic plan, which is the first step in the legislative appropriations request that you'll also be considering later today. And so the staff is finalizing that report, and it is due to the governor's office and LBB on June 1st. So happy to answer any questions.
Members, are there any questions for Ms. McConnell? Very good. We'll move on to item 15. This is behind tab 12. Moving to agenda item 15, Ms. McConnell, please present the fiscal year 2025 bond issuance resolution.
So you've seen this before. This is our request to the Texas Public Finance Authority to issue debt on CPRIT's behalf of $300 million in FY25. Out of that amount, we anticipate issuing $298.1 million in commercial paper notes 4 times during the fiscal year 2025, and that will pay for CPRIT's administrative costs as well as all the grant reimbursements and advances, actually from fiscal years 2019 through 25. So we still have active grants going back to 2019 that we haven't issued bonds for. Are there any questions?
No questions. Members, is there a motion to approve the resolution requesting financing for $300 million in bond proceeds by the Texas Public Finance Authority in fiscal year 2025? All in favor, vote aye. Any opposed? Motion carries.
Thank you.
Now we'll move to our next agenda item, item 16, behind tab 13. Moving on, Ms. McConnell, will you explain CPRIT's legislative appropriations requests for the 2026-2027 biennium?
So our LAR request for the 2026-27 biennium is for the base budget of $300 million per year, or $600 million for the biennium. In addition, we do have some exceptional items that we propose to request. One is actually to request authorization for 10 additional FTEs. So that would take our FTE cap, which currently is 44, to 54 FTEs. And out of those positions, out of those 10 positions, 7 of them are in the grant administration operations. So for example, some additional grant accountants are included in there, another grant compliance specialist, as well as some other program staff to help manage CPRIT's grant and monitor them. In addition, there are also 3 FTEs that are IT related, and those would cover IT systems, also enhance the agency security, and then also support the agency's website. And that request is actually exceptional item 1, which is on 13.4 of your packet. I'm sorry, 13.3 of your packet. No, I was correct first. 13.4, sorry. 13.3 is the overall summary of what the request would look like. But it does lay out how the money has to be reduced out of all of the awards, strategies, and then and the associated costs that are then budgeted in the 2 administrative strategies. In addition, we propose a 10% increase for both of our exempt salary positions. That's the Chief Executive Officer and Chief Scientific Officer. With respect to the Chief Executive Officer position, The legislature did not actually grant the 5% per year increase that was given to all of their state employees in the current biennium for 2024-25. So that's the reason for the requesting the increase at a 10% level. And then for the chief scientific officer, it is to ensure that that position remains competitive with similar positions at other, especially academic medical institutions. This request has to go both into our, there's an executive summary that's provided as part of the LAR. It would be detailed there. And then the exceptional item that's kind of laid out on 13.5 is shows that we also need to transfer money again from our grant award strategies to the operation strategies to support that salary increase for both of those positions. So the overall exceptional item request was about $1.1 million in each year of the biennium. And then on page 13.3, that's how it will be laid out. So it shows we always have to show 5 years of our budget. So what we expended going back to FY23 to the current biennium 24-25, and then what's projected for 26. And then we have to show the exceptional items, which are the 2 columns on the far right, how that changes what would be our standard budget. And so overall, the numbers don't change only because it's all bond money, and we can't get additional general revenue for to support any of our costs, but it's how the strategies are budgeted and authorized by the legislature. If you approve this request, we anticipate that we will get budget instructions from the LBB and governor's office, usually the beginning of June. And then we usually have to submit our request by the beginning of August, which is before the Oversight Committee meets again. So that's why we're requesting this upfront today. But the other thing, we would recommend that once we get it finalized in the structure that has to go into the system that's managed by the LBB, that we have an ad hoc audit subcommittee meeting so that the subcommittee can review this budget and make sure it conforms to what you're approving today.
Are there any questions for Ms. McConnell or the audit subcommittee? Dr. Rosenfeld.
Excellent question. It's 7% and it'll stay at 7%.
May I,
Mr. Montgomery.
Chairman, just a quick question. 10 new FTEs, 25% jump.
Yes.
What has that been building up? I mean, is there a backlog of work, or it seems odd to increase by 25% all at once?
It is, and it's a big ask. 2 sessions ago, we did ask for 8 FTEs, and that was authorized by the legislature. CPRIT is getting mature, and so some of the needs, we're figuring out some of the needs. Also, it has taken us a while to even staff up with the additional 8 FTEs, and so that has been an issue. I mean, that all, COVID and other factors impacted that. But the maturing of the agency and ensuring that we can monitor, I mean, we do have, $1.6 billion of grants under, in our portfolio. And so it is, it's a lot of work. And then also on the IT side, I think we all know that the additional security infrastructure that needs with all of the, potential threats that are out there, those have only grown. And so, we have to make sure that we are providing those services as well.
Any other questions? Great. Do I have a motion to approve CPRIT's legislative appropriations request for the 2026-2027 biennium?
Moved.
All in favor, vote aye.
Aye.
Any opposed? Motion carries. All
Thank
right, we're
you.
moving to agenda item 17, which is behind tab 14. Ms. McConnell, will you explain the recommended contract renewal for the grant management support services contract?
So the staff recommends that the agency recommend authorize its renewal option with General Dynamics Information Technology or GDIT for a contract not to exceed almost $10.9 million in FY 25. This amount includes an annual payment of 1.5, a little over almost 1.6 million as a subscription to the electronic grant management platform that we use for application, receipt, peer review, as well as grant management. The other remaining almost 9.3 million is at a time and materials for GDIT labor and indirect costs that support the other services for making our grant awards, both RFA release as well as peer review meetings. All of the peer review meetings will be held remotely, so none of these costs include meetings at like a physical space, but it does, or travel. But it does support the honoraria that we do pay to our peer reviewers. CPRIT still holds the contracts for the chairs through the review councils, but the other members of the peer review panels are paid through the GDIT contract. This is a fairly large increase of 12.7% from the current contract, which is sits at almost $9.7 million. I'm happy to answer any questions.
Mr. Margot.
They're almost a sole provider, right?
Yes,
Because when we bid them before, there was nobody else, is that right?
no, not a good
But we're
offer the
monitoring their costs
comprehensive.
and their everything, so. Okay, no, that's fine.
Yes, sir.
Any other questions? Members, is there a motion to approve the grant management support services contract renewal with General Dynamics Information Technology for an amount not to exceed $10,892,677? All in favor, vote aye.
Aye.
Any opposed? Motion carries. We're now going to move to item 18, the communications report. The chair thank you, Ms. McConnell. The chair recognizes CPRIT's Communications Director, Mark Lepler, to update us on CPRIT's communication activities.
Thank you, Mr. Chairman, members. I appreciate it. I also feel a little, short today. I didn't bring a pin for everyone, but I know your love of communications is stamped on your hearts. So my report is in the book. I don't have a whole lot to add to it. I know been in communication recently with some of you, and so been several projects going on. We've been quite busy, so I'm happy to answer any questions.
Any questions for Mr. Lepler? Dr. Rosenfeld.
Not really a question. I just want to thank you for the daily updates. Find them very informative, and there's always one or two things I click to find out more. So thank you.
It's amazing how many links Justin can find, and it's a wide world that CPRIT touches. So we try to make it as informative as possible. So thank you for that. I appreciate it. Please let us know if you have any suggestions, or if you see articles you'd like us to include, we can include them.
A few more
Future
pictures of
releases.
cartoons would be helpful for some of us.
Thank you, Mr. Lepler.
Thank you.
Okay, we're going to go back to our program activities reports now to item 7 with the Chief Scientific Officer report. The chair recognizes Dr. LeBeau to provide the academic research program update. As part of her update, she will seek approval for the proposed FY 2025 recruitment RFAs for our consideration. Following her update, she will introduce the Program Integration Committee's grant award recommendations. Mr. Roberts and Dr. LeBeau will also present the CEO's recommendation to increase budgets for 6 training grants previously approved by the Oversight Committee.
Thank you, Dr. Cummings. I will refer you to tab 4 of the OC meeting update book for an update on the academic research program. And today I'd like to present the recruitment award recommendations for FY 24, cycle 24.6, 0.7, 0.8, and 0.9. If we could have the first slide, please. You'll see in this table that the Scientific Review Council and Program Integration Committee has recommended 10 awards from 3 grant mechanisms totaling $32 million, excuse me. I'll just point out that initially 12 awards were recommended. One was withdrawn by the institution in late April. A second grant application was withdrawn by the institution this week. So that application is included in your packets. However, it is not included in the slides that I'll show you today. So today I'll be presenting the 10 current recruitment nominations. In table 2, we see the program priorities that are addressed by the grant applications. If we go to the next slide, please. Thank you. And all 10 of these awards address the recruitment of outstanding cancer researchers to Texas and a broad range of innovative investigator-initiated projects. 3 of them address a high priority of childhood cancers, and 2 address hepatocellular cancer, which is of particular importance in Texas. Okay. We go to the next slide, please. The next, this slide describes the 2 established investigator applications that have been recommended. There were 3 initial applications reviewed and 2 were put forward for consideration for funding. The first is Dr. Thomas Milner, who has been nominated by Baylor College of Medicine for an Established Investigator Scholar Award. Dr. Milner is the director of the Beckman Laser Institute and professor of surgery and biomedical engineering at the University of California, Irvine. And he'll be appointed as a tenured professor and director of the Surgical Oncology Biomedical Engineering Research Program, and will establish a CPRIT-supported Center for Nanophotonics. Dr. Milner is a renowned biomedical engineer and researcher and is an international pioneer in the field of photomedicine with a very strong history of translation. Just to mention one example of his discoveries, he developed a very innovative approach to selectively cooling biological tissues during laser surgery, and this has been widely adopted, benefiting thousands of patients worldwide. Dr. Milner proposes to design and fabricate nanophotonic devices by tackling 3 projects to develop diagnostic and surgical tools for cancer prevention and therapy. And I'm only going to mention one because you'll hear about a related project later from Dr. Smith. In one of his projects, he will be developing a multifunctional mass spec catheter for rapid intraoperative cancer detection. And this is combined with an ability to take a very small microbiopsy, perform virtual histology and tissue resection. And Dr. Milner is a co-discoverer of the mass spec pen that is used during surgery. And Dr. Smith will. There has been a fire emergency reported in the building. Please evacuate the building by the nearest exit.
Sorry, Dr. LeBeau, we are going to stand in recess
No
at
problem.
9:09 a.m. to participate in the mandatory fire drill. Okay, thank you very much. We will now reconvene. It is 9:21 a.m. Dr. LeBeau, please continue.
Thank you, Dr. Cummings. To finish up with one last sentence on Dr. Milner. He is a co-discoverer on the mass spec pen, and the mass spec catheter uses the same technology to detect for biopsy and analysis of cancer tissue. And you'll hear a bit more about the mass spec pen from Dr. Smith because this has been selected for a product development award. The next candidate is Dr. Radek Skoda, who has been nominated by Baylor College of Medicine for an Established Investigator Award. And he is being recruited as a professor of medicine. He's a world-renowned physician scientist whose discoveries have formed the bedrock for diagnosis and care of myeloproliferative neoplasms and acute leukemia. And his work provided new insights into emerging cancer risk factor called clonal hematopoiesis of indeterminate potential. Dr. Skoda was responsible for the seminal discovery of the JAK2 mutation as the most frequent cause of myeloproliferative neoplasms, and this led to the development of tyrosine kinase inhibitors for JAK2. So he has singularly transformed the diagnosis and treatment of all MPN patients across the globe. He is being recruited to continue his work on myeloproliferative neoplasms. And in particular, he is going to study the progression of clonal hematopoiesis to myeloproliferative neoplasms. And just a word to say that JAK2 mutations can occur in the blood samples of healthy individuals, but only a very minute fraction of those individuals develop myeloproliferative neoplasms. And he intends to study the additional genetic and environmental factors that mediate the evolution to myeloproliferative neoplasms in these individuals. I think this work has broad relevance to a spectrum of human cancers, many of which are initiated as a premalignant state and then progress to a malignancy, and has the potential to inform new therapies. We will move to our slate of rising stars. 7 candidates were reviewed and 2 were recommended for awards. So if we move to the next slide, please. The first candidate is Dr. Susan Bowman, who has been nominated by the University of Texas MD Anderson Cancer Center. And she is currently an assistant professor at the Fred Hutch Cancer Center. Dr. Bowman is an accomplished scientist who focuses on modulating the crosstalk between the microbiome and the immune system to improve the efficacy of cancer immunotherapy. And what she is proposing to do is to study the bacteria that resides within tumors, and especially in cancers along the GI tract. And she has found that patients with tumors that contain specific bacteria face poorer outcomes and have an increased risk of cancer recurrence. And she and others have shown that by treating these patients to selectively kill specific bacteria within human tumors with antibiotic treatment can reduce tumor growth. So her goal now is to enhance our understanding of how bacteria within tumors can impact cancer development, growth, and patient responses to treatment. The next candidate is Dr. Oren Ram, who also is being nominated by the University of Texas MD Anderson Cancer Center. And he is an exceptional researcher who has made remarkable contributions to the study of liver and cardiometabolic diseases. For example, he recently uncovered a novel dysregulated pathway that links amino acids and lipid metabolism in metabolic dysfunction associated steatotic liver disease. And this is the new name for NAFLD. And he proposes to focus on identifying metabolic pathways that link 3 metabolites that he has discovered in metabolic dysfunction associated steatohepatitis. And these are N-acetylamino acids, oxalate, and polyamines. And his goal is to both understand how these metabolites are involved in the progression of MASH to hepatocellular carcinoma, and to uncover new strategies to prevent hepatocellular carcinoma by modulating these metabolites. Moving to our slate of first-time tenure track faculty, 19 applications were reviewed and 7 were recommended. Although I will be presenting 6 to you today because 1 was withdrawn. The first is Dr. Isaac Vianu, who is being recommended by the University of Texas Southwestern Medical Center. Dr. Vianu is an extraordinarily talented biophysicist who uses biochemistry and cryo-electron microscopy to study transcriptional regulation by the integrator complex. This is a large complex of 15 proteins that's a critical regulator of gene expression. In his previous studies, he purified all 15 factors and then derived the structures of those factors and the integrator complex, the large integrator complex as a whole. And he also provided some mechanistic understanding of how the integrator complex works to regulate transcription. I should add that the integrator function of the integrator complex is hijacked in cancer cells so that it stops producing proteins that are cancer fighting, but also produces proteins that allow the cells to proliferate, that the cells need to proliferate in an uncontrolled fashion. So what he's proposing to do is to study how it's recruited to specific gene loci in healthy and cancer cells, and how it functions to drive carcinogenesis. I think this basic work is really important because it will provide new insights into the roles of integrator in normal cells and in cancer, but also inform therapeutic strategies that can be used in combination with existing cancer therapies. Our next candidate, shown on the next slide, is Dr. Maria Falzone, who's been nominated by the University of Texas Health Science Center at San Antonio. Dr. Falzone is interested in studying proteins, that the structural biology of proteins that are associated with the cell membrane, and in particular proteins that are involved in transmitting growth regulatory signals from the surface of the cell to the cell nucleus. In particular, she is focusing on phospholipase E, which is a poorly understood phospholipase C family members that has been implicated in cancer and is implicated in sending mediating signaling through the KRAS pathway. And she will study its oncogenic role in gastric cancer. Importantly, she also will work with the CPRIT supported Center for Innovative Drug Discovery at UT Health San Antonio to develop first-in-class chemical inhibitors of phospholipase C epsilon. The next candidate is Dr. Lauren Hagler, who is being recruited to Texas A&M University from Stanford University. Dr. Hagler is the recipient of a prestigious Howard Hughes postdoctoral fellowship at Stanford University. And what she's interested in is the focusing on mathematical modeling and determining the structure of RNA and RNA binding proteins, and understanding how RNA folding and binding in cells modulates transcriptional regulation. And I think it's important to mention that dysregulation of RNA has been implicated in a number of diseases, including many forms of cancer. And now the field is moving from just describing the different mutations that occur in RNA to being able to understand the mechanisms by which RNA function is altered how it's altered in cancer as a result of mutations, and how we can harness these systems to engineer changes in gene regulation for therapeutic intervention. And that's essentially the focus of her work, to focus on the structure of RNA and RNA binding proteins, as well as mutant forms in cancer. This is basic work has the potential to transform our understanding of RNA gene regulation and to inform the development of RNA-targeted therapeutics. Moving to our next candidate on the next slide, Dr. Richard Voigt is being recruited to the University of Texas Southwestern Medical Center. And he is a very talented physician scientist who is exploring the fundamental biology of human hematopoiesis. He has identified an essential gene regulatory network that regulates the growth of hematopoietic stem cells and the production of blood cells. And he has found that this network is hijacked in high-risk AML and is required for the survival of AML cells. So he is proposing to explore the hypothesis that a transcription factor, KIAA 0125, that regulates this network, is a targetable vulnerability in high-risk AML, and to develop tools to specifically block its function as a new class of targeted therapies. His research really reflects his broad approach to applying mechanistic insights from hematopoietic stem cell biology to prevent cancer, and may lead to novel therapeutic candidates in the future. Our next candidate is Dr. Andrew Weems, who has been nominated by the University of Texas at Austin. And he is currently working with a CPRIT scholar at UT Southwestern Medical Center, Dr. Gaudens Danuser. And he has developed a highly productive research program where he focuses on elucidating the role that cell morphology plays in sending growth regulatory signals from the cell membrane to the nucleus, and understanding ways that you can manipulate their shapes to alter cell fate. So specifically, he works with melanoma, and he discovered that as melanoma cells metastasize, they change their shape and they develop bubbles on the surface of the cell membrane and that an entirely novel signaling pathway is activated as a result of those bubbles. And he refers to this as bleb signaling, and proposes that this signaling pathway may be one of the mechanisms by which cells become drug resistant. And that was what he proposes to study in his work, to really to characterize the molecular mechanisms that regulate the activation of bleb signaling, and to investigate its role in disease progression. The next candidate, which is our last candidate, is Dr. On the next slide, Dr. Claudia Way, who is also being recruited to the University of Texas Southwestern Medical Center to be appointed as an assistant professor of pediatrics. Dr. Way has focused on understanding the fundamental mechanisms of tumor plasticity, and specifically the transcriptional and epigenetic regulators that dictate and influence if, when, and how a tumor cell transitions to another cell type, and how these decisions influence response and resistance to cancer therapy. She studies rhabdomyosarcoma and is already the recipient of a K99 R00 NCI Pathway to Independence Award to study this. She has found that rhabdomyosarcomas are heterogeneous and consist of 3 different cell types, 2 of which are proliferative and 1 of which is a differentiated muscle cell. And she has found that the 2 cells types that are proliferative can switch from one type to the next. And she believes that a important transcriptional regulator called EZH2 is involved in regulating that shift between cells that can proliferate and those that cannot, are differentiated muscle cells. And what she's proposing to do is to study how EZH2 functions to lock rhabdomyosarcoma cells in the proliferative cell state and inhibit terminal differentiation into muscle. Again, this basic research has a high potential to advance our understanding of muscle development as well as the pathogenesis of rhabdomyosarcomas. I will stop there and ask if there are any questions on these recruitments before we move on to the next two action items.
Any questions, Dr. Rosenfeld?
Just a quick one. I think you said that two recruits were withdrawn. Could you, just in broad terms, explain why they were withdrawn? Did they get a better offer somewhere else or what?
It's usually because they have elected to accept another offer. And that can be for a lot of reasons. Often it's family reasons, but often it's because another institution has made a strong competing offer.
Any other questions? Very good. Please continue, Dr. LeBeau. Thank
All
you.
right. Our next action item for your consideration is the proposed academic recruits, RFAs. We would like to post the three RFAs for the established investigators, the rising stars, and the recruitment of first-time tenure track awards to conduct recruitment for the FY25 cycle. We would keep the award amounts at the same levels as previous, 6 million, 4 million, and 2 million for the three awards. However, as shown on the next slide, we are proposing to make a change in the number of cycles. And this is based on the patterns of submissions, the numbers of submissions that we receive, as well as advice from our university advisory committee to allow us to adapt to the academic recruitment schedule that institutions use. And what we are proposing to do is to reduce during the first 6 months of the year from July through December, to reduce the number of cycles from 6 to 3. And that's what you see on the first 3 rows. We would have a submission, the cycle would open in June, August, and October. Then during the busiest time of the year, when recruitment is the busiest at the institutions, and we receive our largest number of applications, we would resume monthly submissions from January through July. We believe that this is more compatible with the academic recruitment cycle and would allow us to steward our funds better to last throughout the year to support the best candidates. Okay, the last slide that I have is a proposal for supplemental funds to support research training award grants. You may be aware that the National Institutes of Health recently raised the salary levels for undergraduate, pre-doc, and postdoctoral trainees. Most institutions, in order to be competitive and recruit the best candidates, adapt to the national salary levels for postdoctoral fellows and pre and postdoctoral fellows. We have 6 active training grants that have 2 years left on their awards. And in order for them to be able to remain competitive in recruiting the best candidates for the last 2 years of the award and to support their existing candidates at a competitive level, we are proposing to supplement their existing awards. And on the far right column, you see the total supplemental funds that are requested for 2 years, that's the total sum. So $1.164 million to increase their budgets to allow them to pay the new NIH salary wages.
Thank you for that explanation. Are there any questions? Dr. Patel?
Thank you, Dr. LeBeau. These candidates are extraordinary. My question to you is that we've got an amazing amount of data now, extraordinary amount of data. Would we consider developing a large language model to use and exploit?
I'm sorry, I didn't.
To create a large language model to use, and because it'll be so exciting. I mean,
Yes.
I can see the intertwining of all of these different elements.
Well, we have thought of that and with luck, we will be able to recruit a data analyst and data scientist. That is one of the positions that we proposed that Heidi presented to you. So with luck, we'll have the ability to do that.
Any other questions, comments? Very good.
Thank you.
Okay, thank you, Dr. LeBeau. First, we will take up the award recommendations and the recommendation to increase the proposed budgets. Following those items, we will vote on the proposed RFAs. Mr. Burgess has certified compliance for the Academic Research Award process. It is my understanding that no Oversight Committee member has reported a conflict of interest with any academic research application that we will consider today. Are there any conflicts of interest not reported? Members, you have a list of the applications and grant amounts recommended by the PIC for the Academic Research Grant Awards. We will approve the PIC's recommendation if 2/3 of the Oversight Committee members agree. There are 10 Academic Research Award recommendations. Rather than taking a separate vote on each grant application, I will ask for a vote to approve all the recommendations. If a member would like to consider one or more award recommendations separately from the vote on all of the slates, please make a motion to do so now. I will entertain a motion to approve the PIC's 10 recommendations for the following academic research grant award mechanisms: recruitment of established investigators, recruitment of rising stars, recruitment of first-time tenure track faculty members. All in favor, vote aye. Aye. Any opposed? Hearing approval from at least 2/3 of the members, the motion carries. I'll now entertain a motion delegating the contract negotiation authority to the CEO and to CPRIT staff and to authorize the CEO to sign the contracts on behalf of CPRIT. All in favor, vote aye. Aye. Any opposed? The motion carries. Now moving to the approval for proposed budget increases. Moving on to Mr. Roberts' recommendation to increase the budgets for previously awarded grants. Before we take action on the proposed recommendation, I will note for the record that CPRIT has confirmed that no members previously reported conflicts of interest on any of the approved grants that we will be considering. Are there any conflicts of interest that have not yet been reported? Members, you have a list of the grants proposed budget amounts recommended by Mr. Roberts and Dr. LeBeau. We will approve the budget increases if 2/3 of the Oversight Committee members agree. There are 6 awards constituting a total increase of $1,164,382. Rather than taking a separate vote on each grant, I will ask for a vote to approve all proposed budget award increases. If a member wants to consider one or more recommendations separately, please make a motion to do so now. I will entertain a motion to approve Mr. Roberts' recommendation to increase the budgets for the following academic research grants by the amounts included in his recommendation: RP 210027, RP 210028, RP 210046, RP 210041, RP 210042, and RP 210045. Second. All in favor, vote aye. Any opposed? Hearing approval from at least 2/3 of the members, the motion carries. Now approval for the proposed FY 2025 RFAs. Members, closing out our action items for the academic research program, I will entertain a motion approving the 3 proposed FY 2025 recruitment RFAs as presented by Dr. LeBeau. All in favor, vote aye. Any opposed? The motion carries. Thank you very much. Okay, let's move to item 9, the Chief Product Development Officer report. The chair recognizes Chief Product Development Officer, Dr. Ken Smith, to provide the Chief Product Development Officer's report and present the Program Integration Committee's grant award recommendations.
Good morning. So last we met, we were in the middle of our 24-2 cycle. And we can get the first slide. Keep going. Keep going. So this is where we were with the RFAs. So we had a total of 63 RFAs in the 24-2 cycle. And 3 were withdrawn. And then ultimately, go to the next slide, please. Ultimately, 16 applications got through the preliminary application review cycle and went to a full application review. But two were withdrawn, one technical and one the other company withdrew. So we ended up reviewing 14 of those applications. You'll remember that the last time this cycle only had about 17 to 18 million dollars available for companies. And so what we did was we limited the applications to seeds, which was 3 million, but any of the other RFAs were limited to 5 million. So we figured that way we could optimize the amount of companies that we could fund for this cycle. So ultimately, 14 were reviewed, 6 were recommended, and it came up to a total of about $22 million. And we had about 18.4, I think, available. So we negotiated with the companies and kind of got them to reduce the budget, the secret budget aspect of it. And with a little help from Heidi too, ultimately, we were able to fund all 6 companies. And the best part about being able to fund all 6 companies was we didn't change any of the goals and objectives. So sometimes when we negotiate, some of the goals are reduced so that they can basically get the budget down. But here, the goals and objectives remained. And so the companies basically either we're going to put in more of their money in or match a little bit more. So ultimately we were able to fund all 6 companies, which I think is a good outcome. And it was kind of an interesting experiment in the sense that we had never done something that had limited the amount of funds to anything, around 5 million. So I'll go through the 6 companies in a minute. Next slide. I don't think we have a slide for. And this is just, you can read the priorities, and most of the companies had all 6 priorities through this cycle. So let me talk a little bit about 25-1. We basically started the cycle for 10 days. It was open. The RFAs were open for 10 days. And I think we got the results final. I think it closed last Wednesday. 90 applications, $580 million is recommended. So I'm here today to ask you guys to open your pockets and give us another couple $100 million. You're retiring, you can. Anyway, so it's been amazing. And it's a variety. We've talked about this before. There's a variety of reasons for it, but it is gratifying, but it also puts a strain, as Heidi was talking today about, FTEs and stuff. There are a lot of things behind the scenes that need to be done. But like I said, I'm gratified in the sense that we've been able to get interest, and obviously there's a lot of companies that need funding. So that next cycle is in progress. We'll start the preliminary applications cycle, I guess in a couple weeks, start to have the reviews. And this also points up the fact that the reviewers are so important to this process. And we continue to add reviewers. We can continue to add expertise. Interestingly, in this cycle too, almost half, about 43 applications are seed applications. So the average ask is really only around 7 million. So it'll be interesting to see how this all pans out at the end of the day, but clearly, hopefully we'll be able to fund as many companies as possible. So anyway, that's kind of the update on that. And the 6 companies are, I'll read, take my glasses off. The 6 companies are Crossbridge Bio Incorporated. It's a Houston-based company that's developing advanced antibody drug conjugates, ADCs, targeting various cancers such as breast, lung, ovarian, and bladder. Current generation ADCs face challenges like premature payload loss and resistance by cancer cells. And Crossbridge's solution is to leverage technology from the UT Health Houston, which includes a proprietary linker, which provides greater stability and the ability to attach multiple payloads to the ADC. This innovation decreases the ability of cancer cells to develop resistance, as evidenced by early preclinical data in cancer cells and in animal models. The company's project focuses on targeting TROP2, a protein prevalent in several cancers, and will compare Crossbridge's lead asset, CBB-120, to Trodelvy, which is an existing TROP2 targeting drug. Second company is Akaha Biologics. ACA is a Frisco-based company which is developing AHA 1031, which engages two strong activating receptors in the tumor microenvironment for the treatment of advanced non-small cell lung cancer. ACA Biologics is developing this novel antibody that potentially attracts immune cells to the tumor and activates them to kill the tumor. This antibody binds to a newly validated cancer target on tumor cells and specifically recruits killer cells to destroy the tumor. ACA's novel antibody will have a major impact on the care of lung cancer patients by treating tumors that are not responding to the standard care of treatments. Seven Hills Pharma, and 2 cycles ago, I think we funded Seven Hills Pharma previously. It's a Houston-based company that's developing an integrin agonist to augment hematopoietic stem cell transplant for the treatment of hematological malignancies. The product would benefit patients with leukemia who require stem cell transplant. The curative potential of transplant is limited by timely access to a suitable donor and elevated risk of infection, particularly in Hispanic, Latino, and Black patients who comprise 51% of the Texas population. Umbilical cord blood is readily available, and it's an FDA-approved stem cell source, and it is shown to have curative potential, but it's limited by slow stem cell engraftment, resulting in high infection rates and extended hospital stays. Seven Hills product, given in combination with a stem cell transplant, could ameliorate these limitations and, importantly, decrease racial disparities and increase access to curative therapies. Fourth company is Indapta Therapeutics. Indapta Therapeutics is a Houston-based company that's developing highly potent allergenic natural killer cells for the treatment of multiple myeloma and non-Hodgkin's lymphoma. Indapta has identified a highly potent subset of natural killer cells, GNK cells, that can be expanded from healthy donors. Indapta's GNK product has the potential to be a significant medical breakthrough in treatment of patients with advanced non-Hodgkin's lymphoma and multiple myeloma who have few therapeutic options and are not candidates for autologous cell therapy. Recently approved treatments, CAR T-cell engagers, have limitations, lack of durability, significant toxicities, and manufacturing delays. IDP-23 is an off-the-shelf cryopreserved product that is expected to have few side effects, and it can be easily administered in an outpatient setting. The fifth company, Bactus Therapeutics, is a Houston-based company that is developing an antibody and a companion precision biomarkers for patient selection to overcome myeloid-dependent resistance to T-cell checkpoint therapy. Bactus has identified myeloid cell surface receptors, including a particular protein that suppresses the immune system and drives resistance to existing therapy in 25% of the patients. Bactus has also identified a biomarker that enables precision identification of patients who will benefit from LILRB4 inhibition. The company has generated an antibody that blocks LILRB4 activity and inhibits solid tumor growth and improves survival in preclinical cancer models. And finally, as Dr. LeBeau alluded to earlier, MS Pen Technologies. MS Pen Technologies is a Houston-based company developing what they call the Ultimate Surgical Sensing System, ULTIS, for interoperative tissue sensing and surgical guidance. Incomplete surgical resection of cancerous tissues is a critical problem in the care for cancer patients, leading to consequences such as recurrence, increased treatment costs, and postoperative complications. Current methods for interoperative tissue identification and surgical margin evaluation are unreliable, time-consuming, and require expert on-call pathologists for interpretation. MS Pen Technologies is developing the Ultimate Tissue Sensing System, a platform for tissue sensing and surgical guidance that combines the simplicity of the mass spec pen, the performance of mass spectrometry, and the power of AI and ML software. Altus exploits the fundamentals of tumor biology to detect cancer on a molecular level in vivo to guide surgical decisions made in real time. The company's initial focus is lung cancer, where curative resection is highly dependent on interoperative decision-making. And those are the 6 companies that the PIC recommended for funding.
Fantastic report, Dr. Smith. Are there any questions? Members, Dr. Rice?
Thank you so much for that report. I wondered if relocation grants have decreased. Obviously, there's none in this grouping, and I don't remember how we did last time or whatever, but is there a signal there, or do we see fewer relocation grants?
That's an interesting question that I don't have the answer to. My sense is yes. But I don't have the actual data for that, but we can look it up. It's kind of interesting too. Now that we have so many applications, we'll probably start to try and parse and see where they're coming from, you know, how many are relocations and parts of the country. So some of that data we should be able to get to you, but I don't have it with me right now.
Very good. Mr. Burgess has certified compliance for the Product Development Research Award process. It is my understanding that no member has reported a conflict of interest with any application we will consider today. Are there any conflicts of interest that are not reported? Members, you have a list of the applications and grant amounts recommended by the PIC for the Product Development Research Grant Awards. We will approve the PIC's recommendation if 2/3 of the Oversight Committee members agree. There are 6 Product Development Research Grant recommendations. Rather than taking a separate vote on each grant mechanism, I will ask for a vote to approve all the awards. If a member wants to consider one or more award recommendations separately from the vote on the slates, please make a motion to do so now. I will entertain a motion to approve the PIC's 6 grant recommendations for the following Product Development Research Grant applications: DP 240240, DP 240248, DP 240244, DP 240243, DP 240239, and DP 240245.
Second.
All in favor, vote aye. Aye. Any opposed? Hearing approval from at least 2/3 of the members, the motion carries. I will entertain a motion delegating contract negotiation authority to the CEO and CPRIT staff to authorize the CEO to sign the contracts on behalf of CPRIT.
Second.
All in favor, vote aye. Any opposed? The motion carries. Members, Mr. Roberts notified the board on May 7th that he seeks authority to disperse grant funds in advance to the 6 companies we have just approved for awards. Are there any questions for Mr. Roberts regarding his request? Pursuant to the General Appropriations Act, Article 9, Section 4.02A, do I have a motion to authorize CPRIT to disperse grant funds via advance payments upon execution of the award contract and the successful completion of the tranches to the 6 companies approved for awards today?
So moved. Second.
All in favor, vote aye. Any opposed? The motion carries. Okay, we're going to go back to item 12 and our University Advisory Committee presentation. Dr. LeBeau, please introduce our guest, Dr. Carlos L. Arteaga, who will provide the University Advisory Committee's annual reports.
Thank you, Dr. Cummings. We're absolutely delighted to have Dr. Carlos Arteaga with us here today. Dr. Arteaga is the Annette Simmons Distinguished University Chair in Breast Cancer Research and Director of the University of Texas Southwestern Harold C. Simmons Cancer Center and Professor of Medicine, as well as Associate Dean of Oncology Programs at UT Southwestern Medical Center. I'll refer you to his bio in your book for more details on his training. But I do want to comment on Dr. Arteaga's international expertise as an expert in breast cancer. He has over 350 publications in the areas of signaling by growth factor receptors and oncogenes in breast tumor cells, the development of targeted therapies and biomarkers of drug action and resistance, and conducting investigator-initiated clinical trials in breast cancer. He has, for many, many years, directed a NCI-funded breast cancer SPORE grant, where he co-led several investigator-initiated clinical trials. He's had extensive funding from the National Cancer Institute and other organizations, such as the Department of Defense Breast Cancer Research Program and Stand Up to Cancer. He has, as you see in his bio, he has received numerous awards and recognition for his work. He was elected as the president of the American Association for Cancer Research the largest cancer research organization in the world in 2014, and appointed as the director of the Harold C. Simmons Comprehensive Cancer Center and Associate Dean of Oncology Programs at UT Southwestern in 2017. And I should mention that he is also a CPRIT scholar and received an Established Investigator Award when he moved to Texas in 2017. He now chairs our University Advisory Committee, for which we are extremely grateful. Dr. Artiega?
Thank you, Dr. LeBeau, for that kind introduction, and thank you to the Oversight Committee for the opportunity to present on behalf of the University Advisory Committee that I chair. Do I control the slides here, or do I have to?
I think you can.
It does not. Next, yeah, that's the next slide. So again, I'm presenting to you on behalf of the leaders shown on the left part of the slide, which includes cancer center directors and also institutional leaders, and includes actually 3 Texas Regional Excellence Center accredited institutions, in University of Texas, Rio Valley, Texas A&M, and University of, the other one is Texas Tech University. Next slide, please. We meet twice a year, and we discuss the areas shown at the bottom of the slide: recruitment program, individual investigator research award programs, and return of investment for funding mechanisms. I also try to come up with the best advice for the investment of CPRIT funds on Texas priorities. Next slide, please. This slide shows the academic research program data funding. On the top part, we have the individual investigator research awards, which have had since September to May of last year to May 2024, have had a funding rate of about 15% overall. And this includes individual awards, awards for children and adolescents, for clinical translation, for computational system biology, and prevention and early detection. I should note that that 15% funding rate is higher than the funding rate from grants submitted to the National Cancer Institute. And at the bottom, we have the recruitment awards, which is, again, one of the stars, I believe, of the CPRIT program. Established investigators, rising stars, and first-time tenure track for an overall funding rate of 48%. Next slide. In the next 3 slides, we have tried to summarize for you the return of investment of again on these funding academic funding from CPRIT. I think you have here the investigational. Here you have the individual investigator research awards and the different flavors, if you will, below. Number of awards. The next column is the funding in million. Then the funds that followed and that happened as a result of the initial CPRIT funding. Patents filed, publications, number of clinical trials, and number of patients enrolled. The one that is mature of these mechanisms is the one on top, the individual investigator research awards. Again, you can see here, great return on investment. I would like to point out, when you look at the $471 million of follow-on funds versus the 496, what this suggests is that, again, the initial funding was catalytic for subsequent funding of these investigators. So I think, so again, you can see, again, the different, the ones below that one, those other mechanisms have had shorter lives from 2018 to 2018 to 2015 to 2018 and on. Next slide. These are the, again, shows the return on investment of the core facilities. This is a mechanism that is highly valued by the University Advisory Committee. I should note that I think there's impetus for, again, for any core facility supported by CPRIT to be used not only by the institution where they reside, by other institutions who have, they should have access to these core facilities. And then you have the high impact, high risk awards, which are smaller awards for each of for 2 years and $250,000 of total to enable investigators to test novel and innovative ideas and develop preliminary data for full applications. And again, the ROI has been excellent. If you look at from 47 million that has produced 80 millions, again, suggesting that, again, the catalytic nature, the jump-starting nature of CPRIT funding. Multi-investigator awards are team science awards. They coalesce a number of investigators around a disease focus or a scientific theme. And again, this is an area that has been very productive and as part of the academic support from CPRIT. The next slide shows the what is a very unique mechanism, which is the recruitment awards. Established investigators, rising stars, and first-time tenure track. Since 2016, there have been a total of 313 awards across the different categories. Again, and you can see here again the productivity. If you look at the follow-on funds, you know, which is the fourth column of this on the table. Now, there's something here that in the established investigator row that perhaps is not capturing the fact that a lot of the individuals were people who came as cancer center directors, department chairs, institute leaders, that in turn were the liaisons of the institutional commitment to recruit many more investigators. So that is difficult to capture. But I think that this is really, there's much more in terms of return on investment, I believe, for the established investigator category. Next. Now, this table, again, this is a data table that summarizes the average number of applications, of recruitment award applications, that's on the y-axis, from 2016 to 2022. Blue is established investigators, orange, first-time tenure track, gray is rising star mid-level awards. And what this shows is that the majority of the applications come during the second half, from January to June, whereas there's much less number of subscriptions, if you will, on the first part of the year. This data led to the recommendation, which is in the next slide, of changing the schedule of cycles, reducing the number of cycles from 9 to 6, as shown here. We're having in the first part of the year, one in August and October and November, and the other for the second part of the year, having them every month. And the idea here is to ensure that the budget is distributed throughout the whole year and avoiding the possibility of running out of funds before the end of the year. And also, this is in line with the fact that the majority of the applications, perhaps because of the academic schedules, come in the second half. And Dr. Lebeau elaborated more on this earlier. Now, the next slide is one where we analyzed the distribution of funding by gender. Here you have the total awards from 2014 on, again, as a function of gender and the number that were recommended. Again, if you look at the comparisons of success rate by percent, it's 54 versus 48%, male, female. I'm not sure that there's a statistical difference there, although we still have to do that analysis. There's some years, for example, in 2018 and in 2020, also in 2017, where the rate of funding of applications from female candidates appeared to be lower. But overall, there's not, if you look at the cumulative percentages, it doesn't appear to be a striking difference. However, in the next slide, is something I like to point to you. When we look at the Established Investigator, Rising Stars, and First Time Tenure Recruitment Awards, the last two, Rising Stars and First Time Tenure, there appears to be, again, a close success rate, 35 versus 39, 54 versus 58, female to male. But in the established investigators, we noticed that not only we have fewer applications, 32 versus 117, that is only 21% of applications coming from women. And also we noticed that the success rate is lower, 37% versus 53%. At this point, we don't understand why this is, but this is something we need to look further to make sure that we have, equity, balance, and we're not missing something here that needs to be addressed. Next slide. Now, and this slide is basically a summary of the report from the Perryman Group, which is the value proposition of an economic assessment of the cost of cancer center and the benefits of CPRIT and its programs. In reducing the burden of cancer provides benefits to individuals, families, hospitals, state and local government, insurance providers, and society as a whole. In addition to their positive effect on health and well-being, CPRIT activities generate sizable economic benefits. Every $1 spent through CPRIT for screening prevention saves $2 on direct health spending and leads to a total of $27 in treatment cost savings and resulting economic benefits through earlier detection. The total economic benefits of CPRIT operations, prevention, screening programs, research, outcomes-based prevention screening, and secondary research effects was found to include almost $23.8 billion in output each year and over 200,000 jobs, including multiplier effects. And this is my last slide. Again, these are our recommendations to our recommendations were to, reduce the number of cycles of or RFAs for recruitment awards from 12 to 9 to accommodate budget and institutional recruitment schedules, to reissue the core facility support RFAs, to continue the clinical trial focused RFAs, and this includes the early clinical investigators, the clinical investigators, the clinical trial participatory awards, and the clinical trial network awards. And we believe this is important because this democratizes the access of all Texans to clinical trials. Also, reissuing research training, which is, again, very important, particularly in light, perhaps, of the lower emphasis from NIH on training grants these days. And also continue to promote and talk about collaborations of RFAs targeted to Texas Regional Excellence Center eligible institutions. Again, to democratize, spread, the research excellence across the whole state. And finally, I think we're very interested in continuing to discuss RFAs focusing on emerging issues affecting Texas. Things that come up that we have discussed are things like early onset colorectal cancer, childhood cancers. 1 in 11 children lives in Texas, and also liver cancer, which is one that is, Texas has one of the highest instances in the country of liver cancer. So finally, I'd like to highlight that the COVID catastrophe provided an important opportunity to take stock of priorities and recalibrate existing programs, as well as new programs to leverage the accomplishments of the last 16 years. From the University Advisory Council perspective, the academic program is a remarkable accomplishment, a stable, valuable program supporting all aspects of cancer research in Texas. And the academic research community through the UAC expresses its gratitude to the leadership of CPRIT for their support and the very inclusive approach they have taken to engage the opinion of key stakeholders in the research enterprise. Thank you very much.
Thank you so much for that report and for your work. We're honored you came to see us today, and we appreciate your presentation. Any questions, Dr. Rice?
First of all, Dr. Ortega, thank you so much for being here, number one. As a member of the Oversight Committee now for 11 years, I believe, I think that we've seen progressively better and more engagement. I'm not sure, I'm not trying to criticize anything in the past, but wonderful presentation. Thank you for bringing the perspective across a number of topics that are important. I had a question which may be more for staff than for you, in fairness, but I noticed that the patents, for instance, for the recruits was 278 for recruiting and 121 for the mechanistic core facility, high impact, et cetera. And then, you know, for ours, it's 101. I bet a nickel, those are probably not exclusive, though you can't add those three, but
Yeah.
I was thinking that's a very big number of patents, obviously, and it looks like the total is 278. I suppose that's the highest number of them. Anyway, but I was thinking that it might be interesting to, you know, you asked about the LLM model before, and if you took the patent portfolio that we have and you know, and downloaded the descriptions of the patents, that might be an idea to look for potential collaborators that have not yet found each other, who have intellectual property developed as an idea for development. As we talked about earlier, I just was having that thought as I listened, as a specific example of what you might do to find, you know, areas where there's synergy, which may not be, you know, connected yet to what's in the patents. And
Really good idea.
and the last thing I'll just mention is thank you for the equity report. I don't think I've seen that so specifically before in the work, and really important, and appreciate your highlighting that.
Thank
So
you. Yeah, we have to follow that.
Thank you.
Dr. Rosenfeld?
Thank you. I appreciate the report. And just following up on what Dr. Rice said, on the return on investment part, what really caught my attention was the number of patents. And so just great work by all the investigators. I have two questions for you. One is that the CPRIT experience is really unique. And I was wondering whether you plan to present the data on CPRIT at AACR or ASCO to let the rest of the country and world know what we're up to here in Texas. So that's the first question. And the second is on one of your slides, you mentioned clinical trials. And certainly there's a big population in Texas, and a lot of clinical trials can be done in Texas. And I was wondering if there was, or there could be, a mechanism by which there was a standard approval mechanism for cancer studies at multiple institutions, instead of getting one at Baylor College of Medicine, MD Anderson, UT Southwestern, UT Health Science Center, San Antonio. If we could have sort of a statewide approval of a study to move things along faster.
Yep. About the first question, I like your idea of, you know, disseminating, gently bragging about CPRIT at you know, at AACR, ASCO. I haven't thought about that, but it's something I have to think about. I do have a speed dial to the AACR leadership as former president. Something that would be very interesting. I can think of a CPRIT AACR, I think, session where we identify, say, 4 top CPRIT investigators to the report. I think that would be good. It would be a way to promote the state, to promote what we're doing here in Texas. About the other one, I think the idea of having a statewide common protocol. Well, I think we don't have that now, but the Clinical Trials Participatory Award, for example, you know, Clinical Network Award is one that provides the ability, for example, UT Southwestern partnering with Baylor in Temple, Baylor Scott and White in Temple, with John Peter Smith in Fort Worth, common IRB, same SOPs, again, same protocol, same, you know, the other, you know, same PIs. So I think that's the beginning. Could that be expanded to the whole state? Maybe, you know, but that is a mechanism that could result eventually in that common language network that you're thinking of.
Mr. Montgomery?
Dr. Ardiaga, again, thank you. I don't think we've seen these data reported in this way, and it's tremendously helpful. I looked at first of all, on patents, is that number of applications filed or number of patents granted?
I would have to phone a friend here. I am.
I think it's patents filed.
Yeah, applications filed.
Yeah, applications filed.
Okay. Then number of patients enrolled in clinical trials for many years, the Product Development Advisory Committee suggested that number as a metric for success for CPRIT. Can you give us any context on the 19,000 patients enrolled? In other words, I assume those are people that would not have been in clinical trials, but for CPRIT. But how do I compare that with any other number? I just don't know. That's a lot, that's a little, that's a,
Yeah, what I would do is I would probably look at the number of, one would have to look, the denominator would have to be the tumor registry numbers at each institution. That's what we use in the cancer center. We have 10,000 so we strive to enroll 10%. That is kind of what our peers, in the NCI kind of reacts favorably to, that 1 in 10 is enrolled. So I guess, I don't know, but this numerator would have to be paired with a denominator that includes the tumor registry number at all these institutions. So I assume it's going to be a single-digit %, which is what the country looks like.
Okay. Well, again, thank you very much. Very much appreciate your time and effort.
You're welcome.
Very good. Again, we appreciate you coming today, and safe travels and good luck on your continued work. Thank you again.
Thank you.
Okay, we're going to move on back now to item 10, lest we forget our internal audit report. Next, we will take up the internal auditor's report. The chair recognizes Mr. Graves to present CPRIT's internal audit report.
Thank you. Good morning. Page 7.1 in your packet, excuse me, is our status report that we went over with the audit subcommittee. You'll find we are progressing through the internal audit plan and are scheduled to wrap up all of our procedures here in May and June. The first internal audit that I'd like to go over with you is on page 7-15 in your packet. It's the internal agency compliance. That's the first audit that we have completed, the first full audit that we completed this year. The scope of that was really around the agency or CPRIT's method to monitor their own compliance with requirements for ethics, code of conduct, complaints, as well as required disclosures. We completed that work on March 25th. I'm happy to report back to you that through the scope of those procedures, there were 69 different compliance criteria, and we found no findings. So that's a glowing report back on CPRIT, the agency as a whole, of how well they've done. This is a second time we've done this audit since we've been internal auditor. There are only a few findings the last time we did this audit. Now there are none. And so again, that's just a testament to everyone in the agency and their diligence on ensuring compliance with the various rules and regulations that CPRIT has to comply with. Because there were no findings, hopefully it's pretty obvious that the report received a strong rating, which is the highest rating that we give on internal audit reports. The other report I have to present to you is on page 7-5. That is our follow-up over purchasing compliance. So as a reminder, last year there was one finding in that audit. That finding was centered around the form 1295, which is a certificate of interested parties. That form has to be filed by vendors that have a contract over a certain level. We did all of our testing, did our follow-up work, and identified that finding was completely remediated. So much the fact that the agency did go back and get all the forms that were missing from those vendors. So that also received a strong rating. The other audits that we have and part of our internal audit activity that we have for the rest of the year, we are underway in all of that work. The records management advisory project is a consultative project that we have through our internal audit standards, really focusing on helping CPRIT develop ways to manage and identify records for record retention policy, really focused on automating and using the SharePoint process and identifying some automated ways to manage and monitor those documents, as well as our internal audit oversight committee reporting. So you'll be happy to know this is not an audit of you. This is an audit of the way CPRIT reports information back to you, focusing on completeness, accuracy, timeliness. We also have two other follow-ups, one over communications and some of our IT general controls follow-ups that I know all of those two follow-ups, every item in that are IT related. I know Soma and Shannon have disclosed that to you on their IT roadmap. So we fully anticipate that those will be remediated, if not entirely, almost entirely by the end of the year. The only other thing I'd call attention to is on page 7-4 of your packet. The very bottom of that table is just a tracking of all the open internal audit findings, of which there is one, and that is communications, and that we will be following up on this year. So anticipate by the end of this year that you'll have no open findings, given that the only ones that might have are over oversight committee reporting. I really don't anticipate a whole lot there, but that just again goes to show the diligence in which the agency has addressed any internal audit findings. So with that, any questions for me?
Any questions for Mr. Graves? Dr. Rice?
Can I just make a statement or a comment, having been a long-term member of our esteemed audit committee, that I'm certainly proud of the agency's work to get us down to one outstanding item over many, many years of tracking many, many items of different kinds all the way through. And it's a pleasure to see such a report. So thank you for that. And thank you to the team for
Second
figuring out
that.
how to be responsive that way.
Okay, is there a motion to approve the two internal audit reports presented today? Second.
Second.
All in favor, vote aye. Any opposed? The motion carries. Very
Thank you very
good. Thank
much.
you, Mr. Graves. Okay. We are going to have a closed session here shortly, but before that, we will move to item 19 and our tribute to Wayne Roberts. The roast was done previously, so it's okay. Before we go into closed session, I would like to take this opportunity to recognize Wayne Roberts. This is Mr. Roberts' last meeting as Chief Executive Officer. He has been a remarkable advocate for CPRIT's mission. I know that I speak for my colleagues on the Oversight Committee and for CPRIT staff that we will miss him and his tremendous work on behalf of all Texans. We have put together a short program to convey our appreciation for his 12 years at CPRIT, and we will start with a video.
Good morning, Wayne. As I look back on our relationship in CPRIT, I noticed that we both started at CPRIT in 2013. So we've been together for 11 years. When we started, CPRIT was sometimes in the newspapers, not for the best of reasons. But under your careful guidance and management, you've turned CPRIT into one of the premier cancer institutions in the world. Wayne, I don't know what you're going to do after you leave CPRIT, but don't lose my contact information. Give me a call. We'll talk about chainsaws. On behalf of the current and past board members, Wayne, I thank you for your service. Thank you.
First of all, as I begin this video, I want to know if I'm being paid for it. And since I assume I'm not being paid for it, I'm going to be extremely candid. It's been a pleasure and an honor to work with Wayne as a member of the Oversight Committee since 2015. I've served on lots of boards, served in the legislature, and I can tell you that Wayne is one of the best leaders, the finest leaders I've ever had the opportunity or the pleasure of serving with. He explains things very well, and he reminds us what we can and can't do. He also has a great deal of patience for putting up with both me and Will Montgomery, who's worse than I am. But I want to wish Wayne the very best. I know he'll do well, and as I say, it's been an honor to serve with a gentleman with such integrity.
Wayne, on the occasion of your farewell to CPRIT, please accept these compliments from me. First of all, thank you for your service to the state of Texas and to all those worldwide who suffer from the burden of cancer. When called on to serve your state, you stood up and bravely guided CPRIT through its darkest hours. You brought forward an outstanding staff and gave them the latitude to succeed. When they did, you credited them, and when they did not, you found better people to take their places. CPRIT has become the envy of many around the world and a model for the best kind of government action, to assist those in need when private resources could not do so. Serving on the Oversight Committee has been one of the great privileges of my life, and in large part, I owe thanks to you for that experience. Thank you and Godspeed. I know that whatever challenges life brings you, you will meet them with steadfast and the diligent efforts that I have been privileged to see these past 10 years. To conclude, I have one thought that I hope you will carry with you for a very long time. The Texas Rangers are the world champions.
Strike three, you're out.
Hi, Wayne. It has been great working with you these past 4 years. You have been a wealth of information regarding CPRIT and its impressive history. I will definitely miss your sense of humor and your insights into Texas state government. You have the best stories. Do try to take plenty of time to relax and enjoy yourself. But I'm certain you will soon be involved in a new endeavor, one that will benefit immensely from your talents and unique skills. Thank you for your service to CPRIT and your service to the people of Texas. And most important, go Horns!
Wayne, I hate to see you retire, but my friend, I'll remember you for a lot of things. You rendered a lot of great service to the state of Texas. My fondest memory was when you called me one weekend and said that you had this idea for Texas ought to go for the ARPA-H, new federal agency, and lo and behold, we did, thanks to you gathering together all the parts of the state into one coalition. And Wayne, you pulled it off. We won the ARPA-H bid, and I think that's a great capstone to your career, my friend.
It is my privilege to extend congratulations to my friend and former colleague, Wayne Roberts, as he brings his outstanding public service career to a close. I've known Wayne since our graduate school days at the LBJ School, and we shared many years working together on the state budget, first at the Legislative Budget Board, and later in the governor's office under George W. Bush. It has always been clear to me that Wayne is a committed public servant who is focused on achieving the highest standards of excellence. His warrior spirit has fueled his determination to succeed in every job he has held. And so, Wayne, as you transition to whatever comes next, I want to say thank you for your service and wish you all the best.
Hi, Wayne. Ambrosio, as you know. I just want to say that it was great getting to know you. Obviously, we've had a short friendship. We met in 2020, and I still remember the day we met, and we had a lunch date at that barbecue place. And I remember because it stood out to me that you were trying to keep your fingers clean of sauce, but it was obviously not going to happen. And a true Texan gets your hands involved like we did. Nevertheless, we met and we had a nice conversation, and immediately I knew that you were somebody I wanted to emulate, look up to, use as a mentor. and guide me in this great secret adventure of mine, which I've never been part of. I knew you were a wealth of knowledge immediately. I knew that inherently you knew what was going on with this organization and where it needed to go. And so I'm happy for you as you're taking on a different role, another segment of your life. I'm saddened to see you depart because of our friendship we developed and also because of the immense amount of knowledge you have for CPRIT and our organization. But regardless, I wish you nothing but the best for you and your family. CPRIT loves you, as do I, and we wish you nothing but success.
Wayne, I'm going to miss you. And the reason why I'm going to miss you is because you have taught me and the Oversight Committee members many things as regards how to run and fulfill your fiduciary responsibilities in the Oversight Committee. But more importantly, the valuable lesson that I've learned from you is that you've taught us how to be transparent, truthful, and work as a team. And I really appreciate that, and it is going to help me in many other situations in my life, both personal and professionally. So I really appreciate you. I will miss you. In particularly, I think I will miss your statesman-like approach to the Oversight Committee when you present to the committee, but also with that nice, eccentric, quirky sense of humor that you have, or maybe not have.
Wayne, on behalf of the American Cancer Society Cancer Action Network, I'm honored to be part of this celebration of your outstanding career in public service and the 12 years of your leadership and commitment to the mission of CPRIT. As you know, you joined the agency at a significant inflection point that demanded extraordinary leadership. From day one, you showcased your ability to navigate the unknown, instill trust, inspire resilience, and ultimately allow CPRIT to emerge stronger than ever. The impact of your leadership can be measured many ways, but the greatest will be the number of people CPRIT has given hope to and the lives this agency has saved. You will never truly know the gratitude of the vast number of survivors and their caregivers who have benefited through your leadership, but that's not why you do this work, and we thank you. Wayne, thank you for all you've done to make Texas a leader in the fight against cancer.
Wayne, congrats on this idea of your retirement. I think we all have a little envy in that. We've certainly enjoyed this last 11 years. Hard to believe it's already been 11 years, but 11 years since we met. And you were beginning to tackle the challenges of CPRIT. This has been meaningful work. It's been a great opportunity to serve. Your leadership and collaboration has been fantastic. And the people of Texas are immeasurably improved and served by your work. So we just congratulate you on this work and this new chapter in your life, which is your retirement.
Well, Wayne Roberts, Mr. Fix-It, congratulations on your retirement. You have done so many great things in your history, your career here with the state of Texas, and none greater, none more important than your work here at CPRIT. CPRIT was in trouble. You came at the right time, and you have fixed it, and you and your staff have fixed it. And certainly the dream goes on to give hope to all that are suffering with this scourge of cancer, and that CPRIT is a shining light in the world. And thank you that you saved it, that you kept it going, and you gave confidence to the legislature, and the rest is history. God bless you. Happy retirement.
Wayne, thank you for your friendship, and thank you for your distinguished career to the people of the state of Texas. Because of your decades of public service, Texas is a better place for all Texans. Because of your leadership at CPRIT, not only is Texas better, but you've touched the lives of people all across America, and in fact, people all around the world. Your leadership made a difference. I wish you the best in your retirement. I look forward to seeing you soon, and hook 'em horns.
Hi, Wayne. So glad to be part of your retirement celebration. I was quite flattered to be asked to provide a little tribute. I'm going to do it in the form of a poem. You know, that's probably not my strength. I'm much better at putting people to sleep or negotiating policy. But here it is. In honor of Mr. Wayne Roberts, a pillar strong, for his years of service where he belonged. CPRIT's journey enriched by his care, leaving a legacy beyond compare. Trust, integrity, responsibility defined his days, guiding CPRIT through innovative ways. His departure marks a chapter's end, but his impact on Texas will forever transcend. With a heart dedicated and true, his vigilant spirit our admiration drew. A legacy of service shining bright, guiding Texans through their darkest nights. As he bids farewell to the path he trod, for generations he's left his unique nod. An indelible mark on the fabric of time, a legacy of leadership, pure and prime. So here's to Mr. Wayne Roberts' new dawn, a retirement well-earned, a journey withdrawn. May his days ahead be filled with joy and cheer, his contributions remembered year after year. Best of luck to you, Wayne.
Hello, Wayne. This is not a sad day. This is a thankful day. Thankful for your work, for your over a decade of dedication to the cause of cancer and to making this organization the best that it can be. Your legacy will live well beyond your time here with all the people that you have touched and the processes that you've set in place that are going to take us far into the future. There's no question that this agency is so far better off today than it was the day that you came. And for that, we are eternally grateful. So on behalf of all of the Oversight Committee, both past and present, we say thank you, a job well done, and good luck.
Wayne, I'm pleased I get the opportunity to say thank you on behalf of myself. You've been somebody that's been wonderful to work with. But really, I want to say thank you on behalf of all of the people whose lives have been touched because of your outstanding work. I kind of think of you in the same way as I think of Jimmy Stewart in It's a Wonderful Life. We'll never know all of the lives that have been touched because of the great work that you've done with CPRIT and the difference that you've made. So God bless you and deepest thanks.
Wayne, we have been on quite the journey together in our shared endeavor to make Texas the leader in cancer prevention and research. Working with you to make CPRIT a reality was an honor, and I count you as a friend. For more than a decade, you brought accountability and credibility to the Institute. Without your willingness to serve as Chief Executive Officer, Texas might not have the strong CPRIT we have today. You came to this position with a unique set of experiences centered around research, higher education, and Texas government. Few leaders could offer such relevant experience for CPRIT. Treating and preventing cancer is the greatest challenge of our time, and you have been on the front lines of that battle for a long time. I wish you all the best in the next chapter of life, and congratulations on an amazing career.
And there's more. Okay, now I'd like to present Wayne with a proclamation by Governor Abbott acknowledging nearly 50 years in government service. So this is a little wordy, but I'm going to read it or attempt to. It says, to all whom these presents shall come, greetings. Know ye that this official recognition is presented to Wayne Roberts, Cancer Prevention and Research Institute of Texas. At the very heart of the Texas spirit lies an abiding desire to serve our fellow man. And there are few finer exemplars of this ethos than state employees. After half a century of service to the people of Texas, there can be no doubt that the state is better for your efforts. Although the sheer scope of your career is vast, it pales in comparison to the impact you have made on individual lives and the example you have set for your loved ones. Your selfless leadership has kept Texas at the forefront of scientific progress, and you have helped offer hope to families battling cancer. Today, thanks in no small part to your efforts, patients the world over seek care in the Lone Star State, and you have supported life-saving work through your competent visionary leadership. You have played an important role in the story as big as Texas, and I join a grateful state in paying tribute to you. Your work both at the Legislative Budget Board and at the helm of the Cancer Prevention and Research Institute of Texas has forever altered the trajectory of our state, and you have won the respect of the Governor of Texas twice over. Having proven yourself worthy of the trust that your fellow Texans bestowed upon you, you have built a legacy that will echo throughout the ages long. First Lady Cecilia Abbott joins me in extending best wishes for a fulfilling retirement. And testimony whereof I have signed my name and the seal of Texas to be affixed at the city of Austin this 25th day of April, 2024, Governor Greg Abbott.
Oh, we're not done yet. Not yet. Not yet.
There's more.
Oh, wait.
There's more. Okay. To cap off this presentation, I would like to read a resolution for action by the Oversight Committee. Whereas Wayne R. Roberts has served as the Chief Executive Officer of the Cancer Prevention and Research Institute of Texas since December 21st, 2012. And whereas Mr. Roberts works selflessly for and on behalf of CPRIT, giving his time, reputation, wisdom, expertise, and energy to extend lives and improve the health of Texans. And whereas Mr. Roberts earned the respect and admiration of the Oversight Committee, his CPRIT colleagues, and the greater cancer research and prevention community through his dedication of expanding the life science industry of Texas, fostering innovations for medical breakthroughs in cancer prevention and cures, and championing cancer research in Texas. And whereas Mr. Roberts was instrumental in restoring the Texas legislature's confidence in the agency and ensuring passage of Proposition 6 in November 2019, which provided an additional $3 billion to accelerate the momentum in the state's historic fight against cancer through the next decade. And whereas Mr. Roberts provided steadfast and unerring leadership in carrying out CPRIT's mission, following his oft-repeated mantra that the agency will adhere to the Texas Constitution and state law, document that adherence, and do so as transparently as possible. And whereas under Mr. Roberts' guidance, CPRIT awarded 1,364 academic research, product development, research, and prevention grants totaling $2.85 billion to more than 100 institutions, companies, and community organizations throughout the state. And whereas Mr. Roberts faithfully performed the duties of his position with equanimity, persistence, integrity, and good humor, now therefore be it resolved that the Oversight Committee of CPRIT hereby recognizes Wayne R. Roberts for his distinguished service to the citizens of the state of Texas and expresses its gratitude for his many and lasting contributions to CPRIT, and be it further resolved that an official copy of this resolution be prepared for Mr. Roberts as an expression of high regard by the Oversight Committee members and CPRIT staff. Is there a motion to approve the honorary resolution? Second. All in favor, vote aye. Aye. Any opposed? The motion carries. Comments? Have we said enough?
It is an honor. I'm a lucky man. Thank you.
Thank you again. All of this has been an understatement, I think, of your impact, so we will miss you.
And let's just say that there's much more to say, but maybe not now.
Yes.
I'm around for 6 more weeks. Lots of damage to do.
All right, the Oversight Committee will move into closed session to discuss personnel action related to the Chief Executive Officer position. For the members of the public watching this meeting, other than action related to the Chief Executive Officer position, we have reached the end of our agenda. I do not expect to take up other items after returning from closed session before adjourning the meeting. We go into closed session pursuant to Texas Government Code 551.074 to discuss matters regarding the Chief Executive Officer position. The following CPRIT staff shall join the Oversight Committee in closed session: Mr. Roberts and Ms. Lisa Nelson. The time is 10:51 a.m. and we are in closed session. In open session, the time is 11:22 a.m. I, as chair, will yield the floor to our Vice Presiding Officer, Ms. Cindy Payne.
Pursuant to our discussion in closed session, the Special Ad Hoc Committee recommends that the Oversight Committee hire Kristen Doyle to serve as CPRIT's Chief Executive Officer effective July 1, 2024, and that the salary be set at $282,277. Members, do I have a motion?
So moved. Second. All in favor, vote aye. Aye. Any opposed? Motion carries. Congratulations. We will not take up standing agenda items 20, 21, or 22. Turning to agenda item 23, the next regular Oversight Committee meeting will occur on August 21st. If there's no further business and there are no objections, the chair moves to adjourn this meeting. Is there a second? All in favor? Motion carries. This meeting stands adjourned at 11:23 a.m.